Varnasevich, and I'm here as a Liberty University MSN student. I'm going to be performing a head-to-toe assessment on the patient here, whose name is Tom. Tom, can you introduce yourself?
My name is Tom. Do you want me to give my age?
Date of birth, please.
9/6/62.
Thank you. Are you willing to do the assessment and be videotaped?
Yes.
Thank you. I have a nurse, CRNP here, who's going to proctor me. Patty, can you introduce yourself, please?
Yes. Hi, my name is Patricia Wood. I'm one of the hospitalist nurse practitioners, and I look forward to helping Terry.
All right. Hi. So Tom and I had a quick history prior to this. His only medical condition is hypertension, and he had a recent shoulder surgery, which we'll discuss when we get to that. So initially, we're going to assess skin. Skin is pink, warm, dry, warm to touch. There is no dry patches. I'm going to lift your gown here, Tom. Can I just have this? Your privacy. So I did perform hand hygiene prior to that, and now I'm going to apply gloves for the hands-on physical assessment. So Tom has clean, dry scalp. He has midline male pattern balding. He has even side hair growth. Can you sit up for me, Tom? I'd like to look at the back of your hair. Hair growth is normal, equal, and symmetrical bilaterally. Finishing the skin assessment, he has multiple small brown moles throughout his body. They measure, most of them measure 0.3 by 0.2 or 0.1. He has one left subscapular mole that is irregular in size and shape. It is brown, and that measures 4 millimeters by 3 millimeters. Moving back, you can sit back, Tom, assessing his legs as well with moles. Again, there's scattered moles throughout his lower extremities, and there is equal pattern hair growth on both lower extremities. He does have lateral sparse hair growth here. He has no pedal edema. He has positive pedal pulses bilaterally. Looking at his nail beds, they are pink. They have good capillary refill. Nails are clean and dry and well kept. His fingernail beds are the same. They are also clean, well kept, well trimmed. There is no clubbing noted. His cuticles are adherent to the finger beds. He's wearing eyeglasses, so we're not going to do we're going to just discuss the Snellen test, which he wears eyeglasses for distance seeing, and he has 20/20 vision with that, and this would be the Snellen test that we would do. And then the Rosenbaum test would be the reading, which he would read something closely and make sure his vision was equal distance as well as close up. I'm going to assess his frontal sinuses. Do you have any pain or tenderness there?
No.
As I proceed, if you have any discomfort, just let me know and we'll stop.
Okay.
I'm going to remove your eyeglasses.
Okay.
Put them on the side here, keep them safe. And then I'm going to do your maxillary sinuses. Do you have any pain or tenderness here?
No.
Okay. Looking at his facial symmetry, his cranium is symmetrical. I do not see any distortions either side. His eyebrows are equal bilaterally. Can you open your eyes and look straight ahead? Lids are equal as well. Nose is midline. Facial hair is symmetrical as well. Let's see. So now we're going to move on to his pupils. Tom, I'd like you to look straight ahead. I'm going to check your pupillary reaction. Okay, pupil is reacting, and that pupil is reacting. All right, I'd like you to just watch my finger. All right, he has convergence, it's intact. He doesn't have any nystagmus or pain. Do you have any pain when I do that?
Nope.
Okay, awesome. So, moving along, we will assess, let me have you close one there, hold one nostril closed like that. Can you both air through there? Very good. And then the other side. Both nares appear patent and intact. I'd like you to close your eyes. And in a minute, I'm going to put something beneath your nose. I'd like you to smell. Tell me if you can tell what that smells like. Can you smell anything?
Smells like vanilla.
Very good. That's what it is. All right. So I'm going to get the light. I'm going to shine into your nose. I'm going to check for any lesions, any swelling. I'm going to be careful not to touch it. Septum appears midline. There does not appear to be any deviations there. He does appear to have a mole on the right lateral side of his nose and another on his left mid nose. Have they been there for a while?
Quite a long time.
Okay, have you noticed any changes in them?
Nope.
Okay, great. The other thing I wanted to mention on Tom is that he has a nevi here on the left temporal area of his head. It is pink textured, and that measures 6 by 3 millimeters. All right. So, Tom, I'm going to have you sit up.
Okay.
I take this off so we can assess your lung sounds, please. Okay, you can sit back while I get started. Alrighty, so first we're going to assess his chest. It's equal bilaterally. It's rising and falling. Respirations appear regular and even. He doesn't appear to be short of breath or in any sort of distress. I'm going to have you take a deep breath for me. Out. Again, if you have any pain, let me know. To the middle lobe of your right lobe. Nice deep breath for me. Very good. Okay, I'm going to have you sit up so I can listen posteriorly. Again, deep breaths for me. Okay, lung sounds are equal, clear. You can rest yourself back there. Equal, clear, no adventition sounds either side, either place. Moving right along, I'm going to listen to heart sounds. I'm going to assess his chest. I'm going to feel and assess for any thrills, which we would follow along his heart sounds. Now I'm going to listen to aortic, which is midclavicular, second intercostal space, and right sternal border, and then harmonic, second left sternal border. Herb's point is third intercostal space. Tricuspid and mitral. If I was listening to an apical mitral pulse, I would be listening for 1 full minute. Due to time constraints, we're just going to move on past that. Then I would listen for, again, with my bell of my stethoscope, listening for murmurs. Can I have you sit up, Tom? Like you lean forward and hold your breath. Okay, you can let it out. Thank you. I do not hear any mitral regurg. While you're sitting up here, I'm going to assess your carotid pulses. And I'm going to listen for carotid bruits. If you could hold your breath for me. Okay, go ahead and hold your breath. Okay, good. There's no bruits heard. I'm going to assess the other side. Hold your breath for me. Very good. Okay, wonderful. You can rest back if you'd like. So now I'm going to assess nodes. I'm going to assess periauricle nodes, posterior auricle nodes, occipital nodes, and go ahead and set up. We'll do parotid, submandibular, submental. Okay. While you're sitting there, I'm going to have you take a sip of water so I can assess your thyroid. Trachea is midline, no deviation. Go ahead and take a sip of water for me. So you can identify his thyroid. I'm going to have you stay sitting up. Sorry. I'm going to palpate right, palpate left, edge. I do not feel any nodules. I do not feel any lesions. Do you have any pain or tenderness?
No.
Okay. Madam Imperious midline. I do not observe a goiter. Assessing subclavicular glands as well. Okay, go ahead and lay back. Moving on to his abdomen. Abdomen is slightly rounded. I'm going to raise the bed here if it were. And then we're going to assess your abdomen. It is also with normal male hair growth. There's no patches or bare spots. Abdomen is soft. We'll start in the right lower quadrant. I will listen to vowel sounds. Umbilicus, I do not see any bulges. I do not see any masses. I do not see any bulging or inflammation of his umbilicus. I will begin, after listening, I will begin percussing. Listen for any kind of tympany, anything that might sound adventitious. Everything sounds within normal limits. And now I will palpate. Let me know if you have any pain or discomfort. I'm going to do a light palpation. I'm just going to scoot your shoulders down slightly. Any pain or tenderness?
No.
Okay, now I'm going to do a deep palpation. Pain or tenderness?
No.
Okay, so percussing down to assess the liver. I'm going to have you take a nice deep breath. Okay, I'm going to let it go. I can feel the edge of the liver right below the bottom rib cage there. While I'm on this side, I'm going to see if I can palpate your spleen. which is generally not palpable in most patients. And if it is, we'd be concerned about inflammation. So we're going to go midclavicular line. We're going to no sign of splenic inflammation. So now we're going to assess, see if I can palpate your kidney. You should take a big deep breath. Okay, let go. Stop a little bit. There we go. And same on this side. We're going to assess for kidney placement. See if we can feel it. Go ahead. Let a little bit out, a little more out. Okay, good. All right. Any pain or tenderness with that?
No.
I do not feel any inflammation of the kidneys. Moving right along. So, let's see. We shall bring this down. All right. I'm going to have you sit up on the side of the bed. Right here. I'm just going to come from behind, and I'm going to have you do a shoulder shrug, push up against my shoulders. Okay, any pain or tenderness with that?
Nope.
Thank you. While you're sitting up there, we'll do the Rhine test. I'm going to tap this. You're going to see if you can hear this, and let me know if you can hear it equally or not at all.
Okay.
Tom did mention that he has some hearing loss, so we're not sure.
I can't hear it at all.
Can't hear it at all. Can you hear it here?
No.
Can you hear it here?
Yeah, I can hear it.
Okay, so Tom does have known bilateral hearing loss. He does wear hearing aids. He did not wear his hearing aids today, so he could not hear it in either ear. Air conduction is 2 to 1, so he would be able to hear it longer in the air than when I contact the bone here. So he was able to hear it in this ear. Let's do the same for the other side.
Now I can
And
hear
just, oh, you can hear it on this side? Great. So you can hear it on both?
it. Yeah. I don't know. Yeah, but I did not.
Well,
I could hear it loud.
let's see, can you hear it on this side?
I can't hear anything now.
Okay. All right. So he does have known hearing loss, and that was just demonstrated. Okay. So we're going to change the cap for this. I'm going to look in Tom's ear. Well, demonstration purposes, we are losing. Let me get my otoscope to light up. So, let's see. All right, so I'm observing his tympanic membrane. It is pearly gray. I do not see any occlusions. I do not see any lesions. The exterior of his ear is clean pink. There are no lesions, tumors, drainage present on the lobe or any other part of his ear. And I will do the same in his his right ear. Okay. Again, tympanic membrane is pearly, clear. I do not see any lesions. I do not see any problems. I was able to observe the malleolus on the left ear as well as the right ear, and that is all intact. I'm going to move on to his oral mucosa. I'm going to have Tom look straight ahead. Do me a favor and smile. Now, frown. Show me your teeth. Puff your cheeks. Purse your lips. Very good. All right, now I would like to observe his oral mucosa. is clean pink, and I do not see